I regularly hold community dinners in Rhode Island. We serve pasta and meatballs or hamburgers and hot dogs. We invite people from the community, and we talk about the issues that matter to them. Sometimes I ask people to come together to talk about a particular issue, which is what we did Sunday 2 weeks ago at the Tri-City Elks Lodge in Warwick. I invited Rhode Islanders to join me to talk about our broken healthcare system and what we might do to fix it. More than 200 people came from at least 14 different cities and towns. The parking lot was jammed. The room was packed. Seniors and students, patients and providers, business owners and veterans. They know what is wrong with our system. They experience it firsthand every day. They came to share their frustration, their anger, to tell what's happened to them in a system that too often leaves them nowhere to turn. That evening, I launched a new feature on my website to help people share their stories about health care. At whitehouse.senate.gov/storyboard, there is a forum where Rhode Islanders can read about others' experiences with this broken system and tell me about their own. We gave people who came to the dinner the chance to write their stories right then and there, and one after another, the stories came. Mr. President, if anyone believes we can afford to wait to fix the healthcare system, that this is not an urgent, crisis-level problem for the people of this country, I urge them to listen to what these Rhode Islanders had to say. Sandra from Smithfield wrote, "As of this month, I will no longer be treating my rheumatoid arthritis. The treatment cost almost $6,000 every 6 weeks. The kicker is that I have help from the drug company to pay for the drug portion, but that is only half the cost of administering the infusions. I do not have $3,000 this month. I am begging for universal health care. I am 52 years old. I worry every day when the crippling effects of rheumatoid arthritis will put me in a wheelchair because I cannot afford to treat my disease. Please fight for universal health care. Please help." David from Warwick stood up at the dinner and explained that he began receiving Social Security and Medicare 3 years ago. "Each year since," he wrote later, "the amount I get has gone down because the Social Security cost of living raise has not kept up with the rising cost of my medical coverage. This year I had to cut my coverage. My copays are now more than I can afford." Brandy is a young woman from Johnston, Rhode Island, who has struggled with juvenile diabetes since age 11. She wrote, "Although I have done everything humanly possible to control my diabetes, I still am not able to achieve tight blood sugar control. My diabetes doctor believes the best hope for my health is continuous blood glucose monitoring sensors that would accommodate my insulin pump. Through many requests and many letters to Blue Cross, I have still been denied these life-saving sensors that I desperately need."